How do pathologists analyze bladder biopsies for abnormalities? Imagine a tiny piece of tissue taken from the bladder during a procedure called a cystoscopy. This small sample is the starting point for a detailed process that helps doctors understand what's happening inside the bladder. First, the tissue is carefully preserved in a chemical called formalin to keep its structure intact. It's then embedded in a wax block, which allows very thin slices to be cut for microscopic examination. These slices are usually only a few micrometers thick and are stained with dyes like hematoxylin and eosin, which highlight different cell parts and tissue features. Under the microscope, the pathologist looks for signs of abnormality, such as irregular cell shapes, unusual growth patterns, or the presence of cancer cells. They assess whether the cells look benign or malignant, and if malignant, how aggressive the tumor might be. In cases where larger tissue samples are available, such as after bladder removal surgery, the pathologist first examines the specimen with the naked to note the tumor's size, location, and whether it reaches the edges of the tissue. They then dissect the specimen into smaller sections, making sure to include areas of interest like the tumor itself and the margins, which are the edges of the tissue. This helps determine if the entire tumor was removed, or if cancer cells remain at the edges. Next, the pathologist examines the tissue sections under the microscope, paying close attention to the architecture of the bladder lining, known as the urothelium. They look for abnormal cell growth, cellular changes, and whether the cancer has invaded deeper layers like the muscularis propria, which is the muscle layer of the bladder. This invasion depth is crucial for staging the cancer and planning treatment. They also evaluate the tumor's grade, which indicates how abnormal the cells appear and how likely they are to grow or spread quickly. Sometimes, special techniques like immunohistochemistry are used to identify specific markers on the cells, helping to distinguish different types of tumors or clarify ambiguous cases. Molecular testing might also be performed to gather more information about the tumor's behavior or potential response to treatments. All these findings are compiled into a detailed report that includes the tumor type, grade, invasion depth, and margin status. This report provides essential information for urologists and oncologists to decide on the best course of action, whether that's surgery, chemotherapy, or other therapies. In essence, analyzing bladder biopsies involves a careful, step-by-step process of preparing, examining, and interpreting tissue samples. It's a meticulous approach that ensures accurate diagnosis and helps guide effective treatment, always following established medical standards to provide reliable and meaningful results. Remember, if you or someone you know is undergoing this process, consulting a healthcare professional is key to understanding the specific details of your situation.